Good afternoon, all the second year students. Today we will see the new topic of sedative hypnotics, acute barbiturate poisoning. This question always asked in the annual examination. The acute barbiturate poisoning is occurred due to the overdose taken either by accidentally or suicidal attempt. Now you can take acute poisonings is occur, barbiturate poisoning, because sometimes you can take the overdose by accidentally or sometime in the suicidal attempt. The symptoms, the acute, it should be lethal dose generally is more than the 10 times of the hypnotic dose. The lethal dose is 10 times more than the hypnotic dose. This causes the acute poisoning. Now the symptoms of poisoning. Symptom of acute barbiturate poisoning. When overdose is taken, what happen now in the body? The symptoms is shown. Now the first, patient may be in the coma. Patient may be in the coma. Second, show depress the respiration. Next, fall in the blood pressure. Next, the renal failure and pulmonary complications. Pupils constricted, then temperature may fall with sweating and reduction in blood volume. And death. Finally, death is occurred. Now see the symptoms again. The patient overdose is taken. Patient maybe goes in the coma. Then second symptoms: the patient goes in coma, depression of respiration. Then fall down the blood pressures. Renal failure, pulmonary complication increases. Pupil is contracted, light is came, and then pupils is dilate. dilated. When the comes in contact with the light, pupils is the dilated. Comes in contact light, they are the dilated. Temperatures fall due to the excess sweating or reduction in the blood volume. Finally, death is occur. Now the treatment. First, your approach. Patient need to patients. First approach, patient need to the intensive care is much need. Then maintain the respiration. Second thing, maintain the respiration and blood pressure. Next, third is a patient still is, if patient is conscious, if the patient is conscious, then wash out the stomach, that is called the gastric lavage. With the potassium permanate. Then give the antidote, forceful alkaline diuresis, not diuretic, that is diuresis with mannitol and sodium bicarbonate. Hasten the excretion of barbiturate. Okay, now these are the treatment. Now see again the treatment. First, patient is suffering in the coma. The first patient give the very need the intense care you need. Then maintain the respiration and the blood pressure. Second thing, then patient still is conscious, go for the gastric lavage. Gastric lavage means wash out the stomach with the help of potassium permanate. Remove the barbiturate, those should be in the abdominal, they can use the gastric lavage. Wash out the stomach with the potassium permanate and remove, and patient feeling well. Then you can give the antidote, those can alkaline diuresis of mannitol and the sodium bicarbonate. They hasten excretion of barbiturate, they are removed by the urine, and then neutralize the patient out of the patient goes in danger condition to goes to the normal conditions. Okay, now these are the treatment. Now next compound, you can see the benzodiazepines. This action on CNS. First, the main action on benzodiazepine on the CNS, main action on CNS, they are having sedation, they are having the sedative effect, hypnotic effect, and they act as an anxiety in the sense chinta, worried. They act as an anticonvulsant, seizure, you can say in the feet, Marathi feet, and it acts a good muscle relaxant, central muscle relaxant. That is a good property of benzodiazepines. The main action on CNS The benzodiazepines have sedative effect, hypnotic effect, anti-anxiety, anti-convulsion, and they act as a good central muscle relaxant effect. The main site of action is they act in the brain stem, reticular system. The main site of action of benzodiazepine is act to the brainstem reticular systems. They decrease the time of onset of sleep and increase the duration of sleep. They decrease the time of onset of sleep and increase the duration of sleep. Okay, now next, action on CVS and respiration. Benzodiazepines may lower the blood pressure, and decrease the respiration. Next, effect on skeletal muscle. Benzodiazepines as a good centrally acting muscle relaxant. Next is a skeletal muscle. The benzodiazepines are the very good centrally muscle relaxants. Increase the muscle tone, is a common feature of anxiety, and contributes to HS and the pains. Anti-anxiety and the muscle relaxant property are clinically useful. Benzodiazepine is act as a anti-anxiety and the muscle relaxants. Okay. Now the mechanism of action. Benzodiazepines act by enhancing the presynaptic or postsynaptic inhibition. They have indirect GABA inhibitory transmitter. Action is mimetic actions. Okay. Benzodiazepine acts enhancing the post and presynaptic inhibitions. Now the inhibitory transmission. They act in the GABA receptors, they produce the inhibitory transmissions, and the action is the mimic actions. Okay. Now benzodiazepines are completely absorbed orally. It's used orally, they are completely absorbed. Absorbed by orally and bind to the plasma protein. Because of the different rate of absorption and the metabolisms, the duration of action is different of the different compound. They are widely distributed in the body. Okay. Now see the side effects. First, sedation. They cause the sedation, drowsiness, weight gain. It's a natural. When people are sleep much more, automatically weight is gain. And amnesia. The memory should be in balance. Impairment of the memory. Amnesia means that is a impairment memory. Weight gain. Tolerance developed. Third, in the woman's menstrual irregularities in the woman. Okay. Now these are the side effects: sedation, drowsiness, weight gain, and amnesia impairment, tolerance developed, menstrual irregulations. The weight gain is the sedation cause the weight gain. When you can take much more sleep, automatically your weight should be the rise. Then use the antagonist, means blocker. Antagonist is available. Fumarazenil, used as an antagonist of benzodiazepines. This is a blocker of the fumarazenil. Zenil is a blocker of the benzodiazepines. Is a blocker, that is called the antagonist. Antagonist of benzodiazepines. Okay, it is given in the dose 0.3 to 1 gram, 1 mg intravenous. Okay, it abolishes the benzodiazepine within 2 minutes. Now therapeutic use of benzodiazepine. Therapeutic use of benzodiazepines, that is a short form. It is used as a sedative, hypnotics. Sedative, hypnotics. Second, it is used as an anti-anxiety and anti-neurotic agent. Third, it is used as a skeletal muscle relaxant. Is a good property. Skeletal muscle relaxant. Next, it is used as a pre-anesthetic medication. Pre-anesthetic medication. The preparations and dose. Next, first, ultra short acting that is 1 hour. Ultra short acting duration is 1 hour. Duration of 1 hour. Example, Triazolam, Midazolam. Second, short acting benzodiazepines, 5 to 24 hours. Duration of action of drug in the body. Example, Matrazepam, Matrazepam, dose 5 to 10 mg. Lorazepam, dose 2 to 6 mg. Oxazepam, dose 30 to 60 mg. Last, long acting benzodiazepines, more than 24 hours. Example, most common example, Alprazolam, doctor is right always. Dose is 0.5 to 4 mg. Second, fluorodiazepoxide, dose 20 to 40 mg. Diazepam is also well known example, 5 to 10 mg. Now this chapter is finished. Thank you.